Dr. Eric Janssen is a board-certified orthopedic surgeon specializing in knee and shoulder surgery. He practices at SportsMED in Huntsville, Alabama, and recently presented a program on shoulder injuries and answered the following question: do joint injections cause scar tissue? The following is his response.
I wouldn't say it's caused scar tissue. You know, I'll give the positives and negatives. The positive is that it's probably the strongest way we have to knock down an inflammatory response. So if we stick that in the bursa, we know 70, 80, 90% of the time that's going to knock that thing out of there, you know, and the patient's going to do well. We look really good when we do that, you know, tell the patient, hey, I'll give you a little steroid shot, you'll be okay, and usually we're right. So they come back saying, man, you're good. The problem is and then where you put it. You know, we can't put it directly in a tendon because we know that it can increase the risk of rupture of a tendon. So we got to be careful where we put it. The other thing is how many times we put it in there. You know, if we have someone with a real healthy joint and we try to put it in interarticular, you know, we tell them, hey, this may be just a one-time thing, because if we repeatedly put it in, we could cause a little deterioration of that joint. So there are different areas that we will limit things like that. But in terms of creating scar tissue, it should not do that because it knocks down the inflammatory response, and the inflammatory response would be what would potentially cause that. So I wouldn't blame that directly on the injection itself, probably more the process of why you're giving the injection.
For more information on the diagnosis and treatment options of shoulder injuries, go to sportsmedalabama.com or call 256-881-5151.